we get to hear lot of statements connected to Ayurveda. For example, eating a particular vegetable is good for your eyes, or eating a particular leaf of a particular plant is very good to your eyes. Are they myths or are they reality? Let us try to understand the Ayurvedic perspective behind such statements. For that, let us hear from our chief physician, Dr. Santhakumari.
There are so many misconceptions and misunderstandings about eye care procedures and eye care tips in the name of Ayurveda. So people believe that, some people, that all herbs, all leaves, all roots, all are Ayurveda. It is not like that. Ayurveda is a science based upon strictly Tridosha theory and has its own views and restrictions and theories. Everything is there. So, in the viewpoint of an Ayurvedic theory, what is eye care? That is more important. And so, I have seen the people saying to me, I am doing the Suryapana daily and for the health of my eye. There is somebody saying, I am taking carrot daily and it will protect. Like that, so many things are running here and there, everything in the name of Ayurveda. That is a wrong concept. First of all, we have to know, to understand that nothing is suitable for all people, or means everybody. It varies from one person to another because there is only one person like him or himself in this world. All are having different body constitution and characters and the professional style and the lifestyle, etc. It varies. So it should be charted. Everything should be charted according to that person. Only some general things will be there, but when we go to the depth, it should be varying from one another. Some misconceptions that I have come across is this: yoga, all yoga postures are good for the eye. They will be doing yoga for a long time and they'll be doing all postures, body postures. It is a very wrong thing because you have to consider that particular disease if he has anything. That is very important. And before starting any yoga, he or she has to consult his regular doctor first, whether that particular body posture is suitable for him or not. For example, if there is a bleeding in the retina, or as in diabetic patients like that, that bend down posture should be avoided because it will increase the bleeding tendency. Like that, if there is a traction detachment, something like that, there they have to avoid this type of yoga postures. Like that, it comes to different factors. So if there is some macular degeneration, thinning of the eye like that, then these some postures, especially when they're looking at bright light and always shining sun, that also is not so good. Some precautions should be taken before that. Then another point I usually hear is some food items, that all leaves are good. Leaves preparations are good for the eye health. That also is a wrong concept. Because leaves are good for whom? That is the question. So, something should be there, some theory should be there behind that. So, for kidney patients or for liver patients, he has to consult his doctor before selecting or before blindly taking all leaves. Sometimes it may go to a dangerous situation. Because I always say the people require or need not only eye, he has to consider all organs. If if you're taking something excess means there is something deficient. That should be remembered always. Then so leaves are not good for all patients, especially for children. Only nourishing type should be given for them. Then comes the carrots, very common thing. Carrot is good for eye. It is good for eye, okay. But we have to think, is it good for all people in the world? Irrespective of his age or his systemic disease or taking medicines for his disease, that is to be considered seriously. So, in the name of Ayurveda, this is good, these leaves are good, all herbs are good. That is a wrong concept. Should be selective and should be on the advice of an expert only. Then the physical exercise like running or jumping or this weight lift, etc. This also should be very selective in the case of certain eye disease. For example, for macular edema, don't go for weight lifts or don't go for swimming. It may be good for other conditions. That is why I am saying before starting any special exercise or any special body these movements, have a consultation with the concerned doctor. Don't select by himself or by herself. It will lead only to a dangerous situation.